Is Peyronie's disease reversible? I mean, you mentioned, again, there's surgery, which has a lot of drawbacks, but with something like Xiaflex or a traction device, or even with some of these supplements, are we talking about reversing Peyronie's disease, or are we talking about stopping its progression?
So a little bit of both. So I always tell patients, I'm never going to be able to get you the you had when you were 18. I'm never going to be able to get you a barber pole straight. The goal is to get you a more functional. So if you have a, let's say, 60-degree curvature and you can't have penetrative intercourse, if I can get you to, let's say, 30 degrees and you're able to do that, then that's a win. If you have a 30-degree curvature and some positions are painful, or you have also difficulty with penetration, if we get it down to 15 degrees and then all of a sudden you have a much more functional unit, that's also a win. So the goal really is to get patients' expectations in line with realistic goals of treatment.
Okay, and this is really important. It's going to segue into like my next question or line of questions here, which has to do with the aesthetics of all of this and the distress that comes with that. So, like, what I'm gathering is that some of these treatments can help move curvature into a place that restores functionality.
Mm-hmm.
In your experience doing this work, I'm assuming it's a mixed bag, but how many men continue to be distressed post treatment, even if by objective measure things have improved, functionality has returned, pain has lessened, but the curvature is still noticeable and it continues to cause distress?
Yeah, so I would say thankfully about 90% of guys who fall under my care for Peyronie's disease, they are happy with the outcome. They're kind of regained their confidence, their function, and they're happy and move forward with their lives. About 10% of guys need to have some additional treatment. It's typically another round of 8 injections of Xiaflex if they're on Xiaflex, or continuing with the traction device, some more manual modeling, things like that. So I would say 10% of men need some kind of ongoing intervention even after the initial initiation of treatment.